Americans, do you want universal healthcare? Why not? The US spends almost 2x of their GDP more than the rest of the developed world. This amounts to literally hundreds of billions of dollars every year being lost to middlemen who add nothing other than bureaucratic bloat between you and your doctor. That insane amount of wealth could be used to significantly raise the standard of living for the poorest Americans and improve health across the board through just only better nutrition and education. More than any investment into hospitals can possibly bring the social determinants of health. But it will raise taxes. Do this. Get out your pay stub. Find the line under benefits deductions for medical insurance. Take $10.20 out depending on how much you get paid and put it in your pocket. Take the rest and add it the number listed as Medicare tax. Congratulations, you now have universal health care. Your deductible is now $500, $1,000, your co-payments are $10, $50. You can never go over a limit. You will never face bankruptcy for a medical emergency. But yeah, I guess technically your taxes have increased. Yes. A for-profit system is obviously not working, and a profit motive is terrible for a system like healthcare. There are a lot of examples of other nations that do a better job and don't bankrupt people for normal medical expenses, and it can actually be cheaper by implementing universal healthcare instead. There's no good reason to have the system the US has except that the industry makes a ridiculous amount of money and turns around and spends a fraction of it lobbying Congress to make sure we suffer for their profit. Absolutely. I'm in my 70s, and many of my friends and family in my age group are losing their retirements, due to illnesses or injuries. Being expected to pay 20-30 of a $150K medical bill each year will absolutely bankrupt most people. In my age group these large bills are not uncommon. Yet it seems the majority of in my age group are brainwashed into believing universal healthcare is bad. My sister, who is 6 years older, and living in poverty, thinks Republicans have her back. I told her, she's in for a rude awakening. Yes, because it's the easiest and best solution. It's estimated to cost about $3 trillion less over 10 years than our current healthcare system. It would allow the country to shift to preventive medicine rather than reactive, which would just reduce costs further. It would allow people to take chances with their careers rather than sticking with jobs they hate just for the benefits, and it would stop all those GoFundMe articles about people raising money for something they shouldn't have to worry about. My daughter had a fever abroad in France. We debated frantically if we should take her to the doctor because we didn't know how our insurance would cover it. We thought the worst and that it was COVID. The doctor did a full exam for €30. We were expecting a huge bill after. Nothing ever came. Yeah. The healthcare system in the USA is utter corporatized filth. Burn it to the ground. Edit Lord, I was just venting while drinking last night and I just came back to Reddit tonight. Embarrassed smiley face. Unfortunately, most Americans live their lives based on fear, emotion and hyperbole, so when they hear something as reasonable as universal healthcare, all they hear are their millionaire handlers screaming socialism, communism, blah, 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 un-American, and they bite every single motherfucking time. So, chances are we're going to remain the only modern country without it, because when all you can understand is capitalism freedom, you can't move out of that box. Yes, because I just got fucking denied a COVID shot because they couldn't figure out who to bill, despite it being covered for me regardless of who they bill, because the government pays anyone uncovered. So I didn't get the vaccine and had to leave. Now I'll be unvaccinated for the holidays because there are no appointments where I can correct my mistake and commit fraud and say I don't have insurance. So I can get healthcare. Fuck that. Burn it all down. A million times yes. I already pay thousands a year for premiums for the worst marketplace plan available. It pays for essentially nothing until the $7,000 deductible is met. I'd much rather just pay some more tax in lieu of that and not have to worry about premiums so that I, and everyone, could have healthcare. Not to mention, healthcare is essentially tied to employment now, which is horrible as it prevents people from freely moving between jobs easily. No, because, as Americans, we will find a way to fuck it up. Congratulations on you, McDonald's free universal healthcare. Your deductible is now $150,000. Co-pays are $99. Dental and eye care is not included but can be for an extra $3,000 a month. Or, we are sorry but you do not qualify for reasons such as being 5 pounds overweight, getting a splinter when you were 4, or your presupposition to a predictable action. We could fuck it up hard. Yeah, but no, but really, no. Lobbyists and politicians would find a way to make it absolutely dogshit, creating a massive bureaucracy that would slow the system down to the point where it isn't usable. Public schools have been ruined by politicians sticking their nose in classrooms. The DMV, at least in most places, is nearly intolerable. There aren't many government-run things that are the peak of efficiency. I work in healthcare. I recognize that universal healthcare is a basic right, but I do not see how to fund it in an effective way while still maintaining some quality. I don't know if life would is really a zero-sum game, but the people in charge play it as such, and with that frame I can see it working. That's not to say we shouldn't fight for improvements towards it, but I'd sort of rather fight for realistic goals. I would love it. Sure, lines might be annoying, but I could still get care. Right now, I'm on disability and it's kinda crap. I want to take better care of my teeth too, and it would be pretty nice to have my eyes looked at. Whatever though, I'll keep doing my best for now. Maybe in a month I can afford to fix that tooth that had a part break off because I had way too many sodas when I was a teen and young 20s. Yes, especially to stop the current trend of expanded mid-level privileges. Mid-levels are cheaper to employ, so the suits upstairs are pushing for them to have expanded privileges. This has come at significant cost to patient safety and treatment quality. Universal healthcare would ensure the provider has the proper training and not simply the most cost-effective compensation for the C-suite's bottom line. All the decent Americans do because healthcare is a human right. Unfortunately, a large percentage of our not decent human beings, including all the ones in Congress, the Supreme Court, the White House, and state government. It's what happens when you have a legacy of white supremacy and imperialism. Most of them will try to tell you they are fiscally conservative, but that's just code for greedy bigots. I'm an American who lives in Australia. So I see the benefits of a universal health system. There is also the fact that Americans pay double the OECD average for healthcare and receive developing world health outcomes for their money. Both infant mortality and maternal mortality rates are getting worse every year. If your society is not focused on protecting mothers and babies, it is doomed. Remember the Great Resignation? Employers don't want universal healthcare because then we would all get different jobs. Once our healthcare is not tied to employers, we could have a lot more freedom to choose. The people want single-payer tax-based healthcare the employers don't. Anyone says, "I want to keep my great insurance" is an idiot. They clearly have not made a claim recently. Absolutely. Any policy change to improve the situation would be welcome. I see healthcare policy as a space bound by three lines: price, availability, quality. Policy can move you in the space, but you will need technological or capacity improvements to move those boundaries. I would personally sacrifice some quality for price, but I do not want to sacrifice availability. I personally don't. I've seen too many horror stories from when I lived in Europe. Let me put it this way, look at how the government prioritizes things and budgets money. Now do you trust them to manage healthcare well? I do want the healthcare and insurance industry changed to make it reasonable. The prices quoted are stupid and obviously price gouged. No, I enjoy paying exorbitant sums of money to profit-seeking middlemen insurance companies so I can access healthcare providers which charge marked up prices due to said middlemen. Then when I use the healthcare I'm paying for, not getting the charges covered until an arbitrary deductible is reached. This is clearly the best system God ever invented. I'm from the US, but I live in Europe. When I tell most of my friends back home about how things like healthcare and parental leave work here in Austria, they are like, "OMG, that sounds amazing. We need that here." Then I let them know that my tax and social security amounts to 42, and then they are immediately out like, "Oh, that's insane." No, I have much better and cheaper insurance currently, and it was even better before Obamacare. If anything, you should have more transparency on what everything costs so you can pick and choose what provider to use for what procedure. If you walked in knowing exactly how much it would cost before you went in, it wouldn't nearly be as bad. I'd much rather pay more taxes knowing that everything is covered. Health problems in the US are exacerbated by the inevitable mental struggles that come post-operation due to the absolute clusterfuck of bills that seemingly never end. To January 1, 2024, $1,593,687.42. That would send anyone back into the ER for health problems. Yes, because single-payer healthcare has been demonstrated to work in every other industrialized nation. I'm a big fan of things that work in the real world. Our jackalope hybrid public-private clusterfuck of a system does not. For example, we spend more on healthcare per capita than any other nation, and we get worse results. Half and half. Do I want everyone to have healthcare? Absolutely, especially preventative healthcare to improve quality of life and reduce costs. Do I trust the government to be able to implement a universal healthcare solution that isn't hotshot, full of corruption, and worse than what we have now? Not in the slightest. I have just had my first surgery, it was a doozy. I have excellent insurance. Like you think you have good insurance, you're wrong. That's how good my benefits are. I can't imagine going through what I'm and then worrying about how to pay for it or where my next check is coming from. Healthcare is a basic right. I live in Michigan, which has one of the better adoptions of the Affordable Care Act and relatively affordable health insurance for all income classes. Universal would be nice, but I'm not convinced our federal government would be able to implement it in a way that would make the situation in my state any better. No, but not in the way you think. Universal healthcare just means everyone has healthcare. Under Obamacare, the US effectively does have universal healthcare, it's just provided through private insurers. I do not simply want universal healthcare, I want single-payer healthcare, i.e. Medicare for all. Health insurance premiums for my job to cover myself, my wife and my daughter is 20 of my gross pay. Yeah man, I want universal healthcare. Fortunately my wife works for the state and is really good insurance for cheap, but if it wasn't for that we would be so screwed. Yes. If it makes sense as a country to pay for people's education, regardless of income level, then we should also pay for people's healthcare, regardless of income level. Is our government capable of doing it without making it a complete shit show? That's another question.